Health Novo presents Sushruta, our health awareness channel.
Hi. Whenever we go for a party and we have been introduced that he's a dentist, the first thing is, oh, dentists are expensive. Oh, they charge quite a lot. And I always look at them, I said, no, we don't charge that much. We always feel that we have value for money. But that big question is always there in their mind, that dentists are charging too much. Today, me, Dr. Sandesh Mayekar, practicing for 36 years, and I have a young dentist, budding dentist, Dr. Kaini.
Hi.
And we are going to discuss about the charges. We are going to discuss about what the young dentist can charge and how the senior dentist can charge. So that's what we are going to discuss to clear the mind of all our patients or all of you that dentists are not expensive, dentists are value for money. Am I right, Kani?
Absolutely right, sir. So why, according to you, is dentistry expensive?
Actually, Kani, dentistry is not expensive. People feel expensive because they pay lump sum charges to a dentist. Now let's compare with hospital and dentistry. When you go to a hospital and you have for example, appendix operation, the doctor tells you the charges. And I'll tell you a story about a doctor who told me the charges. He's practicing in so-called 7-star hospital in Mumbai. And he said that if you get admitted on the 4th floor, my charges will be 40,000, which is a general ward. If you get admitted on the 6th floor, which is a deluxe ward, my charges is 60,000. And if you get admitted on the 11th floor, where all these film stars get admitted, I will charge you ₹1,00,000. I said, but appendix is the same. He said, yeah, appendix is the same, we give service. I said, okay. And somebody got operated on 6th floor, the charges was 60,000, but the bill came 1,50,000. So what is that 90,000 for? Oh, 90,000 was for bed, staff, nurses, operation theatre, sterilization, gauze, all the things what they do in operation theatre, etc., etc., etc. Now what happened with us in dentistry? When they come for a cap, what we call as a crown, and if you tell them 10,000, they feel it's too expensive. But this 10,000 is divided the same like hospital. So in dentistry, what one should understand, there is experience and expertise, number one. Number two is the infrastructure charges, for example, is a general ward or a deluxe clinic or a 5-star clinic. And third is the material used in the patient's mouth. Now, expertise, as you are a young dentist, so there is a question in your mind about young dentists, what do they charge, etc. So when I was a young dentist, my experience was less, expertise may be there, but I could not charge. I was charging what my experience, expertise was, that's number one. But a second and third is very important, that your infrastructure, your clinic, where it is, what is the cost of the place, then comes your chair, unit, etc. Like you can see this chair. Now this chair is not very expensive, but if you see this chair, which is quite expensive. Now that money which has been invested in the chair is added to the cost of the patient's treatment. Then comes the material used. Kindly will be surprised that the material what is available in India today one is make in India, that is Indian manufactured. Second, coming from China. Third is Japanese, European or American, which has got CE mark or FDA mark, and which 3, American, Japanese, etc., has got some clinical research done. And so this material is expensive compared to where the clinical research has not been done. So when a dentist a patient goes to a dentist, then there is a difference coming Pastor. If they go to a dentist who is using expensive chair, expensive material, the cost goes high, like 11th floor of that hospital. So the costing will basically depend on the 3 factors which I just mentioned. So it is not just a dentist, it is not just the procedure, it is what is involved in the procedure. And usually the 50% or maybe 60% is infrastructure cost, and the experience and expertise is 40%. So that's the reason the patients feel that they have been charged more. So in fact, I'm telling patients that I tell my patients sometimes my cost is 4,000 or 4,500, but bill comes 10,000 because this is what we use. So that's the difference between the why patients feel expensive compared to medical practitioners, doctors, because they only tell their charges. They don't tell the whole lump sum charges of the hospital expenditure.